Like a heart rhythm disorder. It's called the LongQT syndrome. What were these symptoms?
I had what my mom first told me was a panic attack when I was about 18 or so, and I suffered them on and off for many, many years, and just always thought they were panic attacks. And last March or April or so, I started to get progressively worse, and they seemed to have changed to the point where I would suffer blackouts. And it was then that I determined that something else was going on.
And did you at some point not only black out, but did you not have a problem with your heart?
I had a massive seizure one night, witnessed it by my husband and my son, and it was during that first hospital stay that they ran routine EKG, and they found a long QT on my EKG. During that stay, they also diagnosed me with epilepsy and started me on seizure medication. It wasn't until my last hospital stay that I suffered a cardiac arrest that they finally realized it was a true seizure, but it was a cardiac arrhythmia.
So fortunately, Jan, LongQT syndrome is relatively rare. Her symptoms, for those of you at home, are the symptoms you can have: fainting, seizures, and in your case, sudden cardiac arrest. But a lot of people have no symptoms until one of those bad things happens.
Yeah, that's the problem with LongQT is most people, 50% of patients have no symptoms whatsoever. And Jan, you know, you are the lucky one. Had you not had that seizure, you may not have survived.
So what is this LongQT? We're talking about the heart rhythm, right?
We're talking about the heart rhythm. It's just a rhythm disturbance of the heart that can flip a patient into this erratic, chaotic rhythm known as ventricular fibrillation, which is what Jan had, and that's sudden death, because when the heart is in VFib or ventricular fibrillation, it's not pumping anymore, and that's why she had an episode of sudden cardiac death. And the reason why it's called, you know, LongQT syndrome is very simple. The EKG strip has several peaks and valleys in it, which are the waves. One is called Q and one is called T, so that distance between the Q wave and the T wave, that interval needs to be about 450 to 440, somewhere in there, milliseconds. And if it's anything longer than that, then it's LongQT syndrome. And those patients that have sudden cardiac death, we implant an ICD, which is an implantable cardioverter defibrillator, which Jan had implanted. And what this is, and I have one, I happen to bring one, what this is a small device that we can actually implant under the skin, and it's connected to two wires that then go into the heart. And those wires will sense when your heart is potentially in this ventricular fibrillation rhythm, and it'll shock the heart back into a normal rhythm and save her life.
It's kind of like those big paddles, but it's on the inside, right?
LongQT syndrome is a diagnosis made based on particular findings on the EKG, patient history, and also family history. Additionally, newer tests, such as some genetic tests, can also make the diagnosis of LongQT. LongQT is a description of a finding on the EKG. As you can see here with this EKG, the electrical signals of the heart are represented by a letter. And this first deflection, which is called the P wave, represents the electrical signal going through the top chambers of the heart, the atria. The electricity then heads down to the normal conduction tissue between the top and the bottom chambers. It zips down to the ventricles, and when it goes to the ventricles, you get these large deflections called the Q, R, and S wave. After that, the heart resets, and the resetting of the heart is called the T wave. It's the T wave which lengthens, making the diagnosis of LongQT syndrome. In other words, a longer time from the Q wave to the end of the T wave. Or in other words, a longer time for the heart to repolarize or to reset to allow it to take another beat. Unfortunately, LongQT syndrome can be associated with an increased risk for cardiac arrest and concerning cardiac arrhythmias.